Blood pressure when circulating in the body and blood exerts pressure against the wall of the arteries. This pressure, which is measured with a blood pressure monitor, is measured by means of two digits. The top figure was systolic tension. It represents the tension in your arteries when your heart pumps. The lower figure in the diastole tension, the one in your arteries when the heart is at rest and is. You need to avoid high blood pressure called hypertension to keep your heart and arteries healthy and have no heart disease. Blood pressure is always measured at rest. The ideal tension is 120 out of 80. It should be less than 135 out of 85 at home and less than 140 out of 90. Elsewhere, if you have diabetes, your blood pressure should always be below 130 out of 96. If your voltage often exceeds these numbers, consult your doctor. It is very important. Follow these few guidelines to take your blood pressure. Sit comfortably on a chair in an armchair where you can lean your back. Uncross the legs, place a blood pressure monitor brewer of the right waist around one of your arms, rested on his armrest so that the cuff is at the same level as your heart. Relax for 5 minutes without talking. If you have time, take your tension 3 times. You do not hold. Counts the first results and averages the second and third result. Take note of your results show your doctor. The problem is that hypertension is not always noticeable. Sometimes we call a silent killer. It can be achieved for years without noticing it. When you have high blood pressure, your heart works much stronger than normal and too much force exerted on the wall of your arteries. Over time, it can result in the formation of plaques that impede the circulation of blood in your body and may result in coronary artery disease. If one of these arteries completely crashes, you will have a heart attack. What are the health risks associated with hypertension? Stroke, heart attack, insufficiency, cardiac, dementia, kidney disease, eye problem, erectile dysfunction. To find out if you are doing hypertension, you can ask a healthcare professional to measure it. Take note of your tension at home. Will also help your doctor determine if you have hypertension. Blood pressure in your home. Make sure the device for that logo showing that quitting smoking takes 30 to 60 minutes of exercise a day most days. From the week to eat more fresh vegetables and fruits or unfrozen every day. Opt for low-fat dairy products, whole grains, lean meat, fish and poultry. Limit your sodium intake 2000 mg a day. Made more often cooking and eat fewer prepared foods. Sometimes these changes are insufficient and you will need to take medication to lower your blood pressure.